Hello, my name is Shannon Archibald, and we are going to be doing medication administration and NG, or in an NG tube, and also tube removal at the end of this video. I'm going to already prepare my medication outside of the room, in the med room, and I'm going to do my 5 writes, my 3 checks, and check the orders for the actual medication to be administered. I'm going to enter the room and provide some privacy, and then also perform hand hygiene and identify the patient using their name and date of birth. If they cannot speak, I'm going to check their wristband for that information. I'm going to bring in all my supplies, which I have my kit, and then I think I'm going to get started. So the first thing I'm going to want to do is don on some clean gloves. Try to reduce the risk of getting an infection or any sort of microorganism you don't want in there. And then the next thing I think I want to do actually is get everything all set up, because then I can have a swift motion going through the process. So I'm going to open up my kit, and I start lifting up that. I would do an abdominal assessment before I got the patient all set up, just because that requires removing clothing, which I'm not actually going to do in this video, but I will be setting up our waterproof drape and stuff like that. And then this is also where we're going to put the sterile solution in there. I'm going to open it up, and I'm going to hold the label facing me, and I'm going to pour it on in there, maintaining asepsis, and pour some fluid in there, because that will be used as our flush. And if there was any fluid left, I would name, date, and put my initials on this container. However, that would be discarded because I've used all the rest of the saline. And then at this time, I'm going to disconnect the suction and also put up the head of the bed. So here's disconnecting the suction. We will want to put that in a safe place so it doesn't run away. And then I can put up the head of my bed. So, and you're going to want it to be about 30 to 45 degrees for height. There we go, that looks good. And now that we're all set up and I have my tube, the first thing that we're going to want to do is that we're going to be doing a gravity installation. So I do not need this plunger in there, and this can actually be gotten rid of. For the video purposes, I'm just going to place it there, not actually throw it away. And we can put that right in there. We don't need to alcohol swab that, because it is considered coming out of a sterile container or a clean container. And then before we're even going to do any sort of installation, I want to make sure that the placement's okay. And if you can see that there's a line on the nose, or right coming outside of the nair, and that's going to show that it has not moved whatsoever and it is the original placement. There's other ways you can check the placement, such as x-rays or aspirating for fluid, but that's how I'm choosing to do it for this video. So now that I have my container in there, I'm going to want to clamp off the tubing, because we're going to have to flush it first with 30 mLs of water. So it's clamped off, and I'm going to grab my container of sterile fluid, and I'm going to want to kind of get to eye level and see where 30 is, and then pour it on in there. There we go, and you're going to want to get up to 30 mLs. Perfect. And this is just going to be the first flush. Unclamp it to let it flow through. This might take a minute. You can check for if the patient's comfortable, if they're having any sort of pain, and things such as that. And now what we're going to want to do is instill the medication, since we just flushed it. And like I said, that was already prepared outside of the room, so you're just going to want to pour it in there. Liquid is always best when doing it through an NG or a G tube. Get all the medication in there. We're going to let that flow in there. That can be discarded. Beautiful. Beautiful. So now, since we got all that done, I'm going to want to flush it again, because this is my only medication. If I had multiple medications, we would be installing, or we would be flushing it with 5 mLs in between each medication. Making sure to document correctly the amount of fluid, because you will have to document that later. Making sure also to be over the waterproof pad when you do this. So now I'm going to flush with my final 30 mLs. Perfect. Let that flush. Can sometimes take a little slow, because we are doing a gravity method, so it may not necessarily be the fastest, but that's okay. It really doesn't take that long, so there's no need to rush this. There we go. And while the rest of that's draining through the tube, I'm actually going to open my alcohol swipe, and I'm going to clean off this port, because I will eventually be occluding this, because you don't want to hook up your patient back up to suction immediately after giving medication, because that could decrease the amount that is absorbed. I'm going to clean off that port. I'm going to disconnect this, and that can get thrown away. I'm going to put in there. And give it a couple seconds for that end to dry, and then I'm going to occlude it. There we go. Now, at this time, you're going to want to make sure that your patient stays with their head of their bed up at the 45-degree angle for about an hour, so that way you can reduce the risk of aspiration. And also, you're going to want to not apply any suction for 20 to 30 minutes as well. And that is how you would install medication. When I was done, I'd perform some hand hygiene. I'm going to go to the med room, and I'm going to document the fact that the medication was taken in the MAR, and then I'm also going to document how many mLs were used, because usually people who have an NG tube, they're going to be on some sort of fluid restrictions, or you're going to want to document that. So I would document that the person did have 60 additional mLs just for the flushing, and then the mLs that was there for the medication. And then I would check in on my patient within like half an hour to an hour to make sure that the medication had worked, and reassess them for any sort of needs. At this time, we're going to go to the next dummy, or mannequin I should say, who is set up for the NG tube removal. So we're going to walk on over here. And here's the patient. The first thing I want to do, of course, when you meet up with any patient, is perform hand hygiene. And I'm going to assess the patient for pain and see if they have need to have any like analgesics administered, just because this can be an uncomfortable situation or procedure. I'm going to don myself some clean gloves. And if I was just walking into the room myself right now, there probably wouldn't be a waterproof pad on them, so I would put that on them. But just because we're hopping around here in the lab, he's already set up. The other thing you're going to want to make sure you have is a emesis basin, just because this can be an uncomfortable situation or procedure, and also it can sometimes give the patient nausea, so you'd want to have something that they can throw up into if they feel that they have the need to do that. The first thing that you're going to want to do is, I cannot actually with this mannequin, but you're going to want to flush with about 5 to 10 mLs. Or you're going to want to at least flush it to make sure that there's nothing that's stuck in the tube or any aspirations. So, I mean, 5, 10, 30 mLs, like what you need to do to actually flush it through. And you're going to do that so that the way there's nothing stuck in the tube for when you pull it out, which can get stuck in their throat. And then the first thing you're going to want to do is you're going to want to pull off this tape a little bit carefully, not to like ruin any skin, and assess to make sure that there's no skin breakdown, and how their skin's doing and how they're feeling about it. So at this time, what you're going to want to do is you're going to want to kind of wrap it up in your hand, and then you're going to have them take a very, very deep breath and hold it in. That way you can reduce the risk of aspiration, and you're going to want to do this in a swift fluid motion, because that way it'll be done quicker. So I'm going to say take a deep breath in and hold it. So we're going to do that, and then I'm going to pull it out. There we go, kind of moving things along, and then I have it in this waterproof pad so that doesn't happen, and I can wrap it up and dispose of it that way. I am going to keep the emesis bag close nearby, just because they still might have nausea, and I'm going to want to keep their head up, like their head elevated for a little bit longer too, like half an hour to an hour, just in case they have the urge to throw up. They're not laying down, which would make a risk for them to aspirate. Get them comfortable, make sure the bed's lower, and I'm going to document that I did it and perform hand hygiene, and that is how you're going to, and you also can't forget that you got to do oral hygiene, just because that was sitting in the back of their throat and there could be contents that got spewed back up while removing it, so oral hygiene is always an awesome idea after you remove an NG tube. That's the process.